agency will post a recap of the feedback along with a Q&A that will include the questions we received today and those sent to us by email. Today, we'll start off by giving a little bit of history about the Apple Health Expansion Program and the short-term enrollment management policy. Then Sheldon Prante from our eligibility team will walk through the 3 options. This will be followed by a Menti survey, and we'll provide a little direction on how to use Menti if you haven't used it before. And this will allow you all to provide anonymous feedback for each option. In addition, the question feature has been enabled for today's meeting. If you have a question, you can use the question and answer option, which is at the bottom of your screen, and we will do our best to answer questions live. Any questions that we're unable to answer during the course of today's meeting will be answered in a Q&A document that will be posted after September 6th. With that, I think we have a slide deck to present. Thanks, Sheldon. I appreciate that. Wanted to note, Sheldon, before I pass the mic over to you, that we started the discussion of a short-term enrollment management policy with our Community Engagement Advisory Committee right before the program launched on June 20th, or the applications became available, rather. We did not afford a lot of time for feedback, but we were able to hone in on the enrollment management policy that you see in front of you. This option, which will be shown in the slide deck as option 3, is currently implemented. The agency is really looking for feedback around this policy, as well as the other 2. We plan on incorporating the feedback we received today, both on the short-term enrollment policy that we'll have in place and any long-term solutions we may have. I think I noted that we're not going to be walking through a lot of data today, but would share with you the most recent data that we have here at the agency is that approximately 5,000 individuals have received a denial due to the enrollment cap not being met. And with that, Sheldon, did you want to go ahead and take over?
Yeah, absolutely. And I think there's maybe an issue with the name. Gio's actually presenting, but it's showing up as me. So I think that's what was going on. All right.
Oh, thanks, Sheldon.
No worries. All right. Good morning, everyone. My name is Sheldon Prancy, and I will be going over the slide deck that was sent out to everyone to get community feedback a few weeks ago, and basically just highlighting, as Becky was saying, the 3 original options, and then more so going over the one that was chosen. And then at the end of our slide deck, we're going to do a Mentimeter survey to get your guys' feedback, not only on the option that was selected as the short-term enrollment policy, but on the other 2 options as we continue to gather feedback on what is the best policy for this program. And then just a couple of notes before I get into the slides. So if you guys hear or see short-term enrollment policy or interim enrollment policy, those are, from our perspective, they're interchangeable and they're one and the same. So just so there's no confusion, if you guys were to see, short-term versus interim, those two things are the same as far as this conversation is going. And then, as I mentioned, at the end of this slide deck, we will have a short Mentimeter survey to go over the information again that was presented to get your guys' feedback. And then the question feature will be on during the presentation, but we will wait to answer questions until the end of the presentation and the Mentimeter is done. And at that point, we will start to gather all of your guys' questions and then go from there. All right. So the first slide we're going over is the agency implemented a short-term enrollment policy. And again, we had three options that we requested feedback on initially from this group. And then from that decision based feedback, we were able to make a decision on our short-term enrollment policy. And we'll go ahead and get into those. So next slide, please. Um, and for, um, thank you. All right, so Healthcare Authority is working on several Apple Health expansion areas, including ensuring individuals that are approved for Apple Health expansion stay connected to the program consistent with current Apple Health policies. And again, this is creating a short-term and long-term enrollment policy for ongoing enrollment, and the agency will explore long-term enrollment solutions, which would be IT-based waitlist, et cetera, and will keep the community updated on its progress, which is kind of part of today's feedback session with you guys. So next slide, please. All right, so option one. So again, this was one of the two or one of the original three options. So option one was not selected, but we still wanted to kind of touch on it to show you guys what the three options were. So the first option was reapplication first come first serve, which basically would look at once the cap was met, people applying and being approved based on first come first serve for slots when they became available. Whether this was going to be through maybe potentially like a quarterly basis or being determined somewhere else. And this was one of the options that was presented. Kind of some of the feedback that we received is this wouldn't be particularly the most effective or equitable option for folks. So based on community feedback and our own assessment, this option wasn't selected kind of for those main reasons. So next slide, please. And again, some of the pros and cons for this were individuals. One of the pros was individuals have awareness when the program has openings and when they can apply. And again, so that was kind of the general pro of this option. And then there was again a lot of cons. Just for the agency in general, would be operationally challenging. There'd be a lot of issues making sure that the whole community actually would know that this was potentially an option and there were spots available on a first come first serve basis. You kind of whoever maybe gets their computer first and submits their application, right? That's kind of what this option would be looking like. And we felt that there was, with again, community feedback, felt there was a better option to go with. So this was one of the three original options, but this was not chosen. And next slide, please. So option two, um, the basically what this option was is eligible Apple Health covered individuals. So the description of this would be clients are transitioned into available openings each month from the following programs. So emergency medical or the AEM program, clients turning 19 and aging out of state-funded Apple Health for Kids, individuals whose after pregnancy coverage is ending, so they are on APC coverage, they go to complete the renewal. Their spot, they get approved based on being on that program. And then individuals who purchase a qualifying health plan whose income is below or equal to 138%. So kind of an example of this would be in December, 50 openings become available in Apple Health expansion. And then the following numbers basically kind of break it down as far as those first few descriptors showing who, is going into the program. So, and again, this was one of the original three options, and this one also was not chosen. Next slide, please. And some of the pros of this would be continuity of coverage for individuals who are already receiving Apple Health coverage, aligns with current Apple Health policies, and clients would not need to apply for coverage. It would be auto transition. So basically kind of taking the burden off the client, potentially having to, log on at a certain time and hoping they submit their application correctly. This would be basically kind of an all automated process. The cons with this would does not provide access to populations that are not already covered, which is, we're trying to be able to offer this to anyone and everyone. So that would be a negative of this policy, and it's also operationally challenging, and it would be a manual workload, and there may not be enough space available for all eligible individuals. Next slide, please. And then option three, which was the option that was again selected with community feedback, is the current short-term enrollment policy, which is random selection of denied applications. So what this is currently is HCA will randomly select applications previously denied Apple Health expansion coverage when the program has openings. So this is including the AEM program, early emergency medical program, denied after completing their renewal for APC, children who are turning 19 years old and aging out of their Apple Health for Kids, and QHP whose income is at or under 138% of the FPL. So kind of an example of how this would go is each month HCA will identify the number of available Apple Health Expansion Program openings, and then from that randomly select individuals who were recently denied Apple Health Expansion coverage, and then from that random selection approving them, and then those folks would receive an approval letter letting them know they've been approved, and they would also receive, their P1 card and all those things, etc. Next slide, please. All right, so the pros of option three are this is the current short-term enrollment policy that has already been communicated. And again, this was with community feedback through this TCAC committee. This would be less burden on clients to complete an application because we'd already have them on file that they've been denied. Their information would be there. We wouldn't have to necessarily do any outreach. They would just be put into that random pool and would be able to select from there. And then allows Apple Health and QHP clients the same opportunity for random selection. We're hoping this would help mitigate outreach disparities and would incentivize individuals to continue to apply even if they've haven't already. So on the other couple options, you had to be either already approved on a different program, or it was kind of random selection from a first come first serve, right? Where basically kind of the luck of the draw, you signed on at the right time. So we were looking at this option as potentially more, um, better for folks to be able to have kind of an equal opportunity. So some of the cons of this were unable to guarantee a denied client their place on the list until a permanent waitlist solution is in place. Fails to account for time spent waiting for random selection, and this option does not provide for agency accountability. So again, this is the current option that we have. We're trying to work on a long-term enrollment policy. And again, this is kind of what this meeting is for, is to kind of gather feedback on these three options and then kind of use that to look at our current situation and then also try to apply any of the information that we do receive towards what our long-term goal will be. Next slide, please. All right, so I think at this point we're done with the presentation. So we are going to transition over to the Mentimeter survey, and we'll go ahead and start getting into the few questions that we have for you guys based on the information that we just went over, as far as the options 1 through 3. And then from that point, I think we'll have and Karina or Bonnie, whoever can correct me if I'm wrong. I think we have 2 to 3 minutes for each one of these questions on the Mentimeter, and there is the opportunity to answer each question multiple times. So if you started typing, accidentally hit enter, or you backed out of the page or whatever might happen, you can submit multiple answers on each question. So I think there is a character limit to 200 characters. So again, if you have more than 200 character feedback, you'll be able to submit multiple answers to the questions.
Sheldon, I don't mean
Yes.
to interrupt. Just wanting to note, I see there are a few participants with their hands up. Just wanted to recognize that, but also note that we are asking that you type your questions into the Q&A function, and you'll find that if you hover towards the bottom of your screen, you should see a bar that pops up. One of them is sort of a comment bubble with a question in the middle. Should have the Q&A noted underneath. So if you could use that. And Sheldon, thank you for letting me interrupt you. I appreciate that.
Yeah, no worries. Thank you for going over that, Becky. All right, so we'll give folks a minute here to log into the Mentimeter. So if you go to mentimeter.com or go to menti.com and then enter the code at the top of the screen, 95422862. You'll be able to get into the Menti survey, and then we'll give folks a minute or two to get into there, and then we will go into the questions. And again, if you haven't used Menti before, so if you have an internet browser on your phone, computer, if you go to www.menti.com and then enter the user code of 95422862, you will be able to get to the screen where the questions will automatically appear on your screen as we go through them. And then there'll be 2 minutes or so on each question to provide feedback, and you can provide additional feedback more than once. So if you have, again, a lot of feedback on each option, each question, you can submit multiple additions of feedback. And we'll just give it another second here. All right, so I think we have a good amount of folks in Menti at this point. So there is a disclaimer. So your response to the questions submitted through Menti are anonymous and do not affect eligibility for any Apple Health programs. There is a note, though, that your responses are anonymous. They are viewable during the presentation. So refrain from sharing any personal identifying information. So again, if you might have a question specific to your own situation, this probably wouldn't be the forum to try to get that answered. We can, if you reach out to us, we can try to work with you individually, but this would be more so questions related to the information that we're going over today and sharing. So just a note for that. All right, next slide, please. All right, so the first Mentimeter question or description for the question that's going to follow here. So option one is reapplication first come, first serve. And again, just the description for that in case folks came in a little bit late or didn't see it. The description is App Health expansion openings would be assessed on a quarterly basis or as determined and communicated to the public. And then HCA would do outreach to clients, navigators, community-based organizations, TCAC or its successor to communicate program availability and when applications would be accepted. So this was option one. Again, this was not the option that was chosen as the short-term enrollment policy, but this is the first option that we went over in the slide deck. And then the next question will get your guys' feedback. So what is community opinion on this option? Are there other pros or considerations that were not included in the slide deck? And then you guys will have 2 minutes to provide feedback on this option. And again, this option was not chosen as the short-term enrollment policy. So I think we're about at the 2 minutes, but it looks like we had a couple other folks pop in and are getting some additional feedback. So we'll give it about 30 more seconds here. All right, so I think we are ready to go to the next question. And then again, this is option two, eligible Apple Health covered individuals. And again, just to note, this was not the option that was selected. This was one of the three original choices that was presented for feedback. And the description is clients are transitioned into available openings each month from the following programs. So emergency medical or AEM, children turning 19 and aging out, the Apple Health for Kids program, individuals whose after pregnancy coverage is ending, and individuals who purchased a qualifying health plan whose income is at or below the 138% of the FPL level. So again, this was one of the three original options, and again was not one of the chosen short-term enrollment policy, but was one of the original options on there. So next slide, please. And then the question for community is what is community's opinion on this option? Are there other pros or considerations that were not included? And again, you guys will have 2 minutes to provide feedback on this option. All right, so we are at our 2 minutes, and it doesn't look like any additional comments are coming in for this one. So we can go ahead and go to our last intake question, which would be for option three. So next slide, please. All right, so this is option three. And again, this was the option that was currently selected as our short-term or interim enrollment policy. And so option three is randomly select applications previously denied for Apple Health expansion coverage when the program has openings. So this includes those denied for AEM, denied for not completing their renewal for the APC program, children who are turning 19 years old and aging out of their Apple Health for Kids, and individuals who purchase a QHPA whose income is at or below 138% of the FPL. So this is again the option that was currently chosen for feedback, or sorry, for the short-term enrollment policy, and again, getting your feedback on this option. So again, the question is, what is it? What is the community opinion on this option? Are there other pros or cons or considerations that were not included? And again, you guys will have 2 minutes to provide additional feedback on this. All right, so we've hit our 2 minutes, but it looks like there might still be some comments coming in, so we'll give it another minute here. All right, so it looks like options have, or sorry, feedback has kind of stopped there for questions. So next slide, please. And then which option is better? So obviously you guys were presented all three options, kind of represented the description of each one here. Um, and then basically from this point, just looking for your feedback on what you guys think is the overall best option. Again, option three is the one that has been currently selected, and then just wanting to um, get additional feedback on directly for those options. So we'll give you guys a couple minutes here to vote on this. All right, we've gone a little over 2 minutes and does not look like we've had any additional voting options. So it looks like option three um, receives the most votes as the better option. So next slide, please. All right, and that is the end of our um, presentation for the options and the Mentimeter. Becky, I'm not sure if you had anything you wanted to go over before we get into answering questions or open it up for live questions.
Sheldon, thanks for walking us all through that. I appreciate hearing all of the feedback or seeing all the feedback rather come through the Menti meter. I would note that again, we will be posting this shortly after today's meeting on our website. And so if you have colleagues or if you yourself think of other feedback that you'd like to provide to the agency, there will be an option to submit that either through the Menti or via email. So really do appreciate your time and effort. And Sheldon, I'll hand it back to you.
All right, thank you. So I think before we probably open it up to live questions, we have a couple of questions that are outstanding in the chat, which looks like the first one is related to folks potentially calling HBE and being told that that there's no more spots available to sign up and the limit has been met. I'm not sure if we have anyone from HBE that might be able to speak to this if they know anything on this, but it basically sounds like folks might be calling into HBE and being told that they don't need to apply because there's no spots available.
Sheldon, I think we have Jenny Arredondo on the line. Jenny, did
Let's
you
do it.
want to
Okay,
get in?
perfect.
Yeah, hi Sheldon, and all. I did want to note that I noted that in my notes, it's a little bit tricky to message that the program is at capacity but to continue applying. It's something that we are working on messaging. If anyone has any ideas on how we can message that the program is full, but we still encourage people to apply to receive that denial in order to be considered for any potential spots that open up. I'd be very interested in hearing that. Just want to make sure that our messaging resonates with community. So that's something that I will take back to our team here at Health Plan Finder, and would love feedback on messaging around that.
Awesome. Thank you, Jenny. And then Leachy, it looks like you had a couple questions about clarifying the options. So um, I'll have to take those back and double check the wording because reading your questions, it sounds like it may not be completely accurate. So we'll take those back and double check what our wording is there, and then we will answer those to you afterwards, if that works for you. Looks like you had it on option 2, so we'll double check that. And then next question is, if I did enroll to QHP, am I still going to be eligible for Apple expansion? So as far as the Apple Health expansion, being enrolled into a QHP isn't a qualifier to get into Apple expansion. It was part of those folks that were originally transitioned, but it's not a requirement to be in a QHP to get Apple expansion. So as long as there's a spot available and you were to apply potentially and meet all the requirements, you would be able to be approved. Obviously, at this point, the cap has been met, so it's kind of more of the random selection as we go forward. But if you were to have applied, before the cap was met, being enrolled into a QHP wouldn't be something that was mandatory.
Hey, Sheldon, can I just highlight too that for individuals who are not enrolled in QHP but believe they're eligible for Apple Health expansion, I think this sort of rings true to Jenny's earlier comment, right? Where you do need, in order to be eligible for the enrollment management policy, you do need to come into the system, enter your information, and receive that denial message back, a denial based on the cap. So otherwise eligible, but denied because we've hit our enrollment cap. Is that right, Sheldon?
Yes, that's correct.
Yeah.
And then there is a question, if this presentation is going to be completed in Spanish or other languages. I'm not sure, Becky, if we um, are planning on doing anything along those lines with this. Maybe you can take that one.
Yeah, no, Sheldon, appreciate that. I was just taking a look at that myself. So we do have CART services today in Spanish. I don't know that we have the enrollment management policy deck translated. And so we can certainly make that happen. And so we will translate that as quickly as we can. I will note it does take a couple of days for that to happen, but we'll do our best to get that available to you.
And then,
oh, go ahead.
Oh, sorry.
No, you're fine.
And then there's a question on timeline for transitioning from provisional enrollment management strategy to an IT waitlist. I'm not sure, Becky, if you want to kind of tackle that one a little bit. I think we're still just in the early process of kind of strategizing along those lines, but if you maybe want to elaborate on that a little bit more.
Yeah, Sheldon, really appreciate that. And Joseph, thank you for the question. I would note that we are still working internally to really determine next steps. There are quite a few factors to take into account as we think about an IT-based solution waitlist. So we will be coming back to community once we have a timeline for that. But I think that is why it is important for us to hear feedback on these enrollment management policies and really sounding like option 3 is the best way to go. So any additional feedback on how to make that better or to communicate that to potential enrollees, I think is an area that the agency Healthcare Authority, DSHS, and I think Health Plan Finder too, Jenny noting, I would love to hear. And I'm also seeing, Sheldon, that there's a request for the Menti in Spanish or other languages. I know could do this pretty quickly in Spanish, and we'll do our best to sort of think through how we might be able to accommodate other needs. Certainly, if there's a specific language that someone is looking for, please let us know.
Thank you for that, Becky.
Yeah.
And then there's a question on how many people are in HE, QHP, pregnancy and maternity 19 for option 2. I don't think that's a number that we'd have off the top of our head. We can probably try to find that out and see what the number is for that, so we can take that one back.
Thanks, Sheldon. Yeah, I think that is definitely not something we have today. I see another question here about the wait list. How and who is going to be in charge of the wait list? I think you may be referring to an IT-based solution for managing the enrollment or wait list. And that I think is still work that we're investigating here at the agency. So more to come on that. I don't know, Sheldon, if you would characterize that differently, feel free to jump in there.
No, I think you got it.
Okay.
And then there's a question, how many people are currently covered in Apple Health expansion? I don't have the number off the top of my head and I don't really want to misspeak on it. That's probably something, unless Becky, off the top of your head or kind of in a general number, we can probably take that back and get a more accurate answer than just kind of trying to go off memory.
I do have, as of August 9th, Sheldon, this is information that we shared with another group. There were approximately 11,946 individuals as of August 9th. And again, just sort of noting there, that is a point in time with data. But Sheldon, you're right. If we were to look at it today, it may look a little different as we are continuing our cleanup efforts with initial enrollment.
All right, and then there's a couple more questions, and then we'll go ahead and start taking live questions. One of the questions from the chat is how long is the current wait list? So currently there is no wait list. Again, the third option that's been selected at this point would be random selection for people that have already applied and been denied for Apple Health expansion. So I guess in a way you might look at that as a wait list because you're kind of getting randomly selected from the pool that would be potentially pulling from. But as far as just an actual wait list, like there's 1 through 100 or something on a wait list, we don't have anything at this point. As we're kind of looking, as Becky mentioned earlier, to a potential IT base wait list, that might be something where we have that in the future, but at the moment we don't have that. And then there's also another question: do we have numbers for the enrollees per county? I think that's something that we could probably get, Becky. I feel like I've actually seen something around that, but we can take that one back too.
Yeah, Sheldon, noting a couple of things. I know we published before some numbers based on region. I would say the agency has some privacy policies regarding small numbers. And there are some counties that have less than 10 individuals enrolled. And so we don't disclose exact numbers if it's less than 10, but we could do our best to come up with enrollees by county. We'll have to take that back, Sheldon.
Okay, sounds good.
Yeah.
All right, I think we got through most of the questions. So again, we're trying to get through all the questions, but if there's ones that don't get answered, we're going to follow up afterwards through email to you guys and through an FAQ. But at this time, I think we got through most of the questions in the chat. So if anyone has a question, I'm not sure if you need to raise your hand. Becky, you can clarify that for me if folks need to raise their hand. If we wanted to do anything over the phone that wasn't asked through chat.
No problem. And yes, I would say let's have folks raise their hands if they would like to ask a question of us. You can certainly do that If you go down to the bottom of your screen, and I believe it's under React, as you're hovering there over your bar, you should see a bar that says raise hand. I see a couple of folks are familiar with that feature or have quickly learned how to adapt there. And so I think we've got, I see Lychee has her hand up. And so Lychee, I will go ahead and let's see here.
I think you
Go
unmuted
ahead. You
me.
should be able
Thank you.
Yes, I did. Okay.
Thank you so much, Becky and Sheldon, for this presentation. Can you share with us what the next steps are for HCA in terms of making a decision around the three options and when we will find out about that, as well as when we'll hear more about the data questions that were raised to inform the feedback for this?
Sure. I think that's two parts. So, Sheldon, if you have a preference here, feel free to jump in. Otherwise, I can start to address.
Yeah, you can start, then I'll jump in.
Okay, perfect. So what I would say is that we are in the middle of our feedback period right now, and that ends on September 6th. And this is specific feedback to the enrollment management policy options that we just walked through. At that point, the agency will take into consideration the feedback and input that we've received from community and make some decisions on how we might incorporate some or all of that feedback into our enrollment management policy. And I think on our timeline, we allowed ourselves a solid 3 weeks so that we could ensure that we really had an opportunity to think through what community is asking and make the right changes or make the right edits to the policy as needed. I would also note a lot of the information that you've provided today is very valuable, just sort of outside of option 3 as we think about the future of enrollment management, including things like the IT-based solution waitlist. And so I really do appreciate the participation. I don't know, Sheldon, anything that you would add there?
No, I think you covered it.
Hopefully I didn't misstate anything, but feel free to correct me if I did. And then I think, Lychee, your second part of your question was around data. And I think we will be sharing additional information about data points with the Community Engagement Advisory Committee at our next meeting. And I think externally, we will have our client dashboard for Apple Health will contain information or data about Apple Health expansion for public viewing. I would note that that shows data in a point of time, right? So it is pulled on a certain date and it is information that reflects the data on that date. And note that, as I mentioned before with Sheldon, we are still working through doing some cleanup of the initial enrollment into Apple Health expansion. So some of those numbers are in flux. So just want to provide that perspective as you look at our data that we may be presenting in different forums or on our website. Sheldon, is that a good way of describing sort of where we're at right now with data?
Yeah, I think so. Yep.
Yeah. Let me know. I mean, feel free to add there.
Yeah, and then it looks like a few more questions came in through the chat, so I don't know if there's any other folks that want to ask a question live over the phone. If not, we can go into those.
I have Jose on the line with a question, so I am going to unmute Jose. Jose, are you able?
Yeah, can you hear me?
I can certainly hear you.
Yeah, so and I could wait for the answers at a later meetings, but I have a few things that questions and concerns and comments. One would be, I think in order to do the outreach and I guess canvassing, not door knocking in some ways, using other terms, but I'm just worried about the community. I'm just wondering, like navigators, if we have like number of navigators per community. I don't know if that's part of the data or not, like the people that we're contracting with, but also the number of navigators per county, because that will make a huge difference of who we're reaching to. And of course, we want to cover everybody as much as possible, and we hope that one day we would be able to do that. But for my part, I'm just wondering, is there going to be a way to support this team, the state? Is there going to be some bills that we could advocate for? How do we support this idea of insuring everybody that needs insurance? I know they need to qualify, but how do we support the needy in our community? Thank you so much.
Jose, appreciate both questions here. I think sort of a two-parter, right? So the first one there is really wanting to understand how many navigators are in community. And Jenny, I'm not sure if that's something that you can answer, or if you'd like to take that back or address that in some other way.
Yeah, that's a great question, Jose. A lot of our navigators don't just reach one community in general. So that's something that I can take back to the team to see all the different communities that the different navigators are reaching. But there is a lot of overlap in terms of who they are helping. And certainly navigators by county is data that we could get you and share back. But yeah, interesting question that I will be taking back to our navigator team to see kind of the list of the different communities that all of our navigators reach. But there are over 1,000 navigators throughout the state and throughout the different counties. So I will come back with some more data to share on the different populations that they are connecting with and the areas that they serve.
Thanks, Jenny. I appreciate that. Hopefully, Jose, that helps. And I would say, of course, working with your legislature to make, or legislators rather, to make your community needs known is always a good way of advocating for things. Certainly, I'm sure there are colleagues of yours on the line there that could provide other avenues, Jose. But just noting here, the positionality of the Healthcare Authority as a cabinet agency. So just, I would reach out and certainly use your known audiences. So thank you, Jose, for that great question. Also wanting to note that Nate, thank you, Nate, has noted we have already translated the presentation deck this morning into Spanish. Thank you so much, Nate. I completely spaced that, so appreciate the reminder on a Monday morning. So for those of you who are interested in the Spanish translation of this morning's deck, you can find that in the chat or comment, or I'm sorry, the webinar chat. Sheldon, I don't see anyone else with their hand up. Did you? Oh, I'm so sorry. Nedra has her hand up, and then do you want to, we'll go ahead and hear from Nedra, and then we can pivot back to the Q&A.
Yeah, sounds good.
Hi, thanks. I just wanted to respond to part of Jose's comment. So my name is Nedra Rivera. I'm the hotline manager, she, her, AR, my pronouns, with the Washington Immigrant Solidarity Network, WISN. And one of our legislative priorities this year is precisely what Jose was talking to, with increasing the funding for Apple Health expansion. So I can share, I was looking for the best link to share that, and unfortunately I couldn't find it in the interim, but I can share that with you, Becky, if you all wanted to share that with the follow-up notes about the best way to stay connected. You can go to our website, wison.org, and just sign up for our general action network, but we do have a specific mailing list for health equity. Yeah, so I hope that's helpful.
Thanks, Nedra. Appreciate that. All right. So Sheldon, I don't see any other hands up. If you want to pivot back to the Q&A.
All right, sounds good. So let's see. The next question that we have in there is how many people have been denied due to the cap currently? Again, Becky, I'm not sure if you know that number off the top of your head. I don't. I'm sure we can probably try to figure that out. So that's one we can take back and see. if we know what the number is for that.
I know earlier this month it was approximately 5,000, Sheldon, but again, I don't have the exact number, and so we can certainly take that as an action item.
And then how often is random selection occurring? Is it every month, quarterly? I don't think we've kind of gotten that far yet to determine if option three is when it's implemented, if there's additional feedback and all that stuff kind of gets through that process. If it gets to the point where we are using that going forward, I'm not sure if we've talked about yet as far as if it's going to be monthly, quarterly. I think it kind of depends on um, what the enrollment looks like in the program. So, we might say like, hey, we're going to do it every month, but there, could be no spots available, right? So I think we kind of have to give us some time to see if there is any what's called, churn in the program where people are kind of moving in and out. And again, I'm not sure if Becky, if you have a more concrete answer than what I'm given, but I think we haven't gotten to the point where we kind of know if it's going to be a monthly or quarterly kind of. I think we were hoping to wait, a couple months to see kind of, if there are any spots, if there are spots that come available, etc.
Yeah, Sheldon, I think this is one of those nuances that's difficult with alpha health expansion. I think what we have to remind folks is that what we're working with is a capped budget. And because we have a limited number or a limited amount of dollars to work with, service dollars to work with, the agency had to come up with sort of an enrollment cap, right? And so that fiscal modeling, really looking at the cost of the program, is something that our finance division is keeping a close eye on. And what I would note is that it's not always an equal, right? If one person leaves the program, it doesn't mean there's an automatic spot for another person, because really what we're doing is managing to a budgetary number. So that's a bit of a nuance. And so really wanting to highlight that for folks. But yes, I think as far as knowing when we're going to have spots available, that is still something that we're working through here as an agency. We are literally, right, 57 days live with the program right now. And so still in early days. I know we have communicated as broadly as we can prior to today's meeting that we do not expect to have any spots available in the first quarter, but really wanting to make sure that we have this opportunity to vet the enrollment management policy, hear from all of you prior to having openings that needed to be filled. So again, thank you very much for your participation today. Sheldon, would you add anything there or edit anything?
No, I think you got it.
Okay, perfect.
Thank you for jumping in. All right, and then I see a question, how and who are going to be in charge of the waiting list? What happens if people move? How can they report? So again, there's no wait list at this point. If we were to have one in the future, that's a question we can probably figure out the logistics for as far as all that stuff. But typically if someone, we'll just say as far as the random selection, right? Like we'll say someone applied last month, got denied, and they move or whatever, right? They should be contacting either the health benefit exchange or they can contact the healthcare authority to update their address. Obviously, I'm assuming this is moving within state, right? Because obviously, if someone moves out of state, they're not going to be eligible for the program based on residency. But as far as just a change of address within the state, they would just want to kind of do their normal process, whether it's through um, Apple Health programs through HB Healthcare Authority, or if they're 65 plus and going through DSHS, or maybe they're um, you know applying for something else, right? Like they would just have to contact whoever the agency is that they're working with to update their address, and then we can go from there. And then obviously, if they went to the wrong agency and they contact HB or Helpline Finder HCA when they're on a DSHS program or vice versa, the agencies work with each other to say like, hey, your stuff is actually with this agency, and here's the number, email, etc., to report it to them. So as long as they report it to someone, we can kind of help them with that. And then next question is, how many people have been denied with language preferences other than English and Spanish? Again, I'm not sure if that's something that we will have the ability to find out. but we can take that back and do our best to see if we can get that information. And then Becky, I'm not sure if you want to take this one. So once HCA decides on a policy, will there be an opportunity for the TCAC and broader stakeholders to weigh in?
Sure. And so just to clarify, I think we have implemented option 3, and this was really our opportunity to provide a broader stakeholder this was really the kind of the forum to provide stakeholders outside of the TCEAC to weigh in. And so we have shared this slide deck, today's meeting, the email address, and ways to provide the agency feedback to as many community-based organizations as we can. So certainly if there is someone we've missed, if you want to forward information and or reach out to the Apple Health Expansion inbox, we'd be happy to reach out to a community-based organization that you think, or an individual, whoever that might be, to provide additional feedback.
Thank you. And then there is a question around budget. So did HCA request additional funding for people to enroll in AHE in the governor's budget? If so, how much? Is that one you want to take, Becky, or do we need to take that back?
Sure. So I would say that we are in the middle of our decision package running right now. We are, as I think we've shared with the Community Engagement Advisory Committee and other groups, we will be requesting additional funding to add enrollees into Apple Health Expansion once we firm up our decision packages, which will be right around the first couple of weeks of September. They will be available to the public, and B, that information will be widely known. We can certainly cover it in a Community Engagement Advisory Committee. And like I said, it will be posted on OFM's website for the public.
And there is a question on the slide deck, and I'm assuming probably also the Menti meter, if it will be translated into any additional languages such as Chinese, Vietnamese, Russian, etc. I'm not sure if that's the case or not, Becky. Do you know?
Yeah, we appreciate the request for the additional translations. So Chinese, Vietnamese, and Russian, and we'll do our best to get those posted and translated. Thanks, Sheldon. I see Nedra has posted in the Q&A the link for Weisson's Health Equity for immigrant campaign updates. So Jose, if you haven't seen it, it is in the Q&A. So certainly feel free to access that piece of information there. Sheldon, was there another question here that you wanted to cover?
There was one, I think it might be one that you would want to give an answer to if you know. Given the HCA shifts responsibility for language access to MCOs, how is HCA monitoring and enforcing language access?
So I think great question, and appreciate that, Lychee. We're really trying to concentrate today on our enrollment management policy, but I will note that we have directed our MCOs to provide interpreter services support to providers for Apple Health Expansion enrollees who need translation services. We are monitoring them in a variety of different ways, and we'll continue to do so. And we can provide some additional details here at a future meeting and make that more publicly available. So appreciate that. I think I see Lychee's next question, Sheldon, and I don't know if you want me to start and maybe you weigh in, but this is really around whether we put this policy into rule rather than just emergency rule. And I would say that we are planning on going into permanent rulemaking in the months of October and November. I think at that point, We'll have to see what the agency's plans are for any additional changes or long-term enrollment strategy. My guess is that we will have a short-term enrollment management policy, sort of the revised option 3. I think from today, it seems like that seems to be the trend that would be in our permanent rules. But again, I think we have a couple of months before that happens, and so I don't know that that's anything that we've driven to the definite. Sheldon, do you disagree there, or?
No, I think you got it.
Okay. And I just want to note, I apologize, not everybody can see the Q&A, and so I did put in the chat Nedra's comment and link.
And I'm just scrolling through the questions. I think we have answered all of them. Again, Leach, I think the ones that you put in there and originally that I kind of already addressed that we would take back as far as option 2 and the wording. But I'm not seeing any other ones that we haven't got to.
I see we just, Leachy just placed one in the chat around DACA recipients. Sheldon, I don't know that we're prepared to answer that question today, but she's saying, can HC or HB share more information about how DACA recipients will be notified about their new eligibility for APTCs and transition from Apple Health expansion, or what is the timeline for sharing that information publicly? Again, I'm not sure that we have that answer right away, Sheldon, so certainly.
Yeah, I think we would want to take that one back.
We're going to take that back. I don't know, Jenny, if you have anything to add there from the Health Benefit Exchange's perspective.
I do not at this time, unfortunately, Becky.
Yeah, no problem. Leachy appreciate the question, and we'll take that back. Did we want to open back up to live questions as well, Sheldon?
Yeah, we can do that.
Okay. I do want to note here as well, I don't know that the agency has ever translated a Mentimeter before, so we're going to take a look on how that might translate into other languages, and we'll do our best to accommodate translating the Mentimeter. If there is a problem with that, I think we'll figure a way to communicate that. But certainly, we will get the slide deck updated and sent out in different languages, or posted in different languages. I think we've got one hand up here. Leachy, there we go. I think I unmuted you. Okay.
Thanks, Becky.
Yeah.
I'm curious, we appreciate the focus of this is mostly on enrollment management, but curious when data on the people who have been denied Apple Health expansion due to the cap will be shared, because I think understanding who's in the categories specified in options 2 and 3 might inform people's opinions about options 2 and 3.
I appreciate that, Leachy. So I think what you're really asking is, you're asking when data around folks who have been denied due to the cap, and then also data around folks who are currently in one of the other programs or who have been denied enrollment into Apple Health expansion as they age out or their after pregnancy care ends.
Yes.
Okay. All right. I would just note too, I think, like I've noted, there's a lot of cleanup here that we're doing around this initial enrollment. We did try to successfully transition folks, as we stated very early on in implementation, individuals who were aging out of Apple Health for Kids or whose after pregnancy care was ending in June and July. And I think we're still working through some of those numbers right now. So Leachy, I think we're going to have to take back a timeline on when we're able to provide that finite level of detail here. But Just note here that we're working as quickly as we can to accommodate those requests. And like I said, we'll follow back up. Any other questions? And Sheldon, I don't know, I'm not seeing the Q&A now that I was looking at the chat, so my apologies.
No, it doesn't look like any new questions have come in.
Okay. I was gonna say, I was hoping you would just hop in there if I missed something.
Yep, no, it doesn't look like anything.
Okay.
So yeah, we've got about 10 minutes left. So
Mhm.
again, if there's any additional questions, I'm not sure if Becky, if you have, if you need a couple minutes to wrap anything up. So do we want to give it till like 9:55 for questions, and then you can do an ending if you need to?
Certainly we can do that. So I can just note again, we will be posting this information on our website after today's meeting. And the enrollment policy feedback opportunity is slated to end on the 6th of September. And then, like I noted, at least 3 weeks for the agency to incorporate this information and provide sort of a solidified option as we move forward. You will see a summary on our website, as well as a copy of the Q&A here. So the questions and what we answered. And really just want to take a moment to appreciate everybody attending this morning. And I think other than that, Sheldon, I just was thinking I'll fill in some of the airspace in case that elicits any questions.
No worries. Looks like we did get one from Lychee. Will the FAQ be shared before the deadline for feedback?
Yeah. So I think we are going to work as quickly as possible to get the Q&A from today's session up. So our intention is to get that up quickly, Lychee, but that does take some time. Some of these questions are more complicated, so we will do the very best that we can. Sheldon, does that sound about right?
Yep, that's correct.
Yeah.
All right, still not seeing any new questions. Does anyone have any
Yeah.
questions or have their hand raised for any questions over the phone?
Sheldon, I don't see any hands raised. Lychee, let's see here. There we go. Go ahead.
Thanks, Becky.
Yeah.
Given that there were significant disparities in who was able to enroll in Apple Health Expansion, does the Healthcare Authority or the Health Benefit Exchange have plans to attempt to address those disparities, or any timeline for addressing those disparities?
So I think you're asking specifically the using enrollment data. How are we adjusting our outreach and communication plans for additional openings, either within Apple Health Expansion or for open enrollment at Health Benefit Exchange?
Yes.
Okay, sure. So I think we are looking at our data here at Healthcare Authority and thinking through that. I think that's part of the exercise that we have around enrollment management right now. I would say that the self-selection of languages and race does give us a data point, but would note, again, this is self-selection. So if someone doesn't see themselves in the list, we all know that they can respond in a variety of different ways. So certainly looking to make sure that we partner with Asian Pacific Islander, and African communities as we move forward. And so if there are folks on the line who would like to provide the Healthcare Authority and Health Benefit Exchange with community-based organizations or leaders, or folks who have connections to those communities that you think we have yet to really tap into, we would really appreciate hearing that. We continue, or having that information shared. We continue to work hard to cultivate some of those relationships ourselves. And Jenny, I don't know if you want to say anything more specific from the Health Benefit Exchange's perspective about outreach.
Sure thing. Thanks, Becky and Lychee, for that question. We are doing a multicultural campaign that's separate from our larger OE messaging campaign. OE means open enrollment, open enrollment messaging campaign. So we will be doing one that's targeted to different communities in different languages. We are also distributing $225,000 in microfunding to trusted messengers, community-based organizations that work with diverse communities to help get the word out about open enrollment to their community. So we will be distributing dollars to community to share about open enrollment and the enrollment opportunities. So the application is due September 6th, and I can put the link for the application and more information in the chat.
And I was muted. My apologies. Just wanting to note, Jenny, thank you very much for piping in there. And I would also note Joseph has a comment in the Q&A that ACRS is also deeply interested in knowing how the agency will address the equity issues going forward and outreach funding with enrollment strategies. I hear that, see that. I think Jenny and I and our agency stand ready to do a better job of partnering, certainly. And any direct feedback about ways that we could partner with communities and be in contact with those trusted messengers, we really do look forward to hearing some concrete suggestions in that way. Like I said, we continue to brainstorm and work internally and with our known external partners, but always looking for ways to branch out as well. Jenny, any thoughts there?
Yes, always interested in increasing our partnerships and our relationships with community members and ensuring that we are reaching folks in the languages that they speak and with words that resonate with them.
Thanks, Jenny. Appreciate that. And I think with that, Sheldon, I am not seeing any hands up, and I don't think any new questions in the Q&A.
No, I don't see any either.
Mm-hmm.
I think there was a few a few from Lychee, and then a couple more that maybe were over live that we're taking back to answer with the FAQ. But again, just wanted to thank you all today for participating. This was really helpful for us to get additional feedback on these options and just kind of seeing where we are with them and where you guys may be expecting us to be with them. So again, really appreciate you all for taking the time to join us today and asking some really great questions and helping us get the feedback that we were looking for. So I know Becky said that this is going to get sent out and there'll be an opportunity to provide additional feedback. But again, just thank you from us for taking the time to be here and helping us with what we're trying to do. So appreciate it.
Couldn't agree more, Sheldon. Thank you all for joining and have a wonderful day.